I'm glad to be here.
It's a pleasure to have you here indeed. So just like I introduced, we are going to be talking about lack of inclusiveness of persons with disabilities, specifically targeting health services, and just like he has here noted. So without wasting much time, could you give us the state or the current status, or you can explain to us the current status of persons with disabilities in regards to the challenges they face while accessing these health services?
Thank you so much, Luke. I want to begin by saying we commissioned a study on the status of the orthopedic workshops in Uganda.
Okay.
And we've already validated the report, and we have even prepared a position paper that we are going to present to Parliament. The findings are really so appalling. One, I want to say rehabilitation services are not only meant for persons with disabilities, but also for other persons with different health conditions. People who have diabetics, people who have pressure, people who have got accidents and so forth. In regard to persons with disabilities, the challenges that we face there as persons with disabilities, one of them is the distance.
Okay.
The rehabilitation services are quite distant. In Uganda, they are only available in the national referral hospitals and also regional hospitals. Whereas those hospitals are very distant and very far from the community. Now, persons with disabilities are poor, and they are not able to trek all that distance to go and access those services. So the second challenge is actually that poverty. These services sometimes are not free. When they go to the hospital, regional hospital, sometimes they have to incur a cost. One, they have to pay from the border from the community where they stay to the nearest town, then from the town to the district where the hospital is situated. For example, if I give you people in Karamoja, they have to trek all the way up to Mbale or Lera. If you are in Moroto, you have to come to Mbale. If you are in Nakapiripirit, for example, people in Ikumi have to. So that's the second challenge. The other challenge is lack of awareness.
Okay.
People with disabilities, and also many people out there, are not aware of the existence of these services, where they can get the services. There are those few who can even afford or who could be sponsored, but they don't know where do we get these services from. So again, you find that they are not able to go to the service, to get the service. Then the other challenge is the limited number of personnel in the health, in these facilities, in the rehabilitation facilities. There are few people. So a person will come today wanting a service. Then you are supposed to wait. You'll get one person maybe serving over 70 people. So you sit in the line, wait. By the time it reaches you, the staff is already tired. Now you are supposed to get, for example, an appliance maybe. They're supposed to take your measurements. They're supposed to make, then they tell you, go back. It is late, and come back. You are a person with disabilities, and you are moving a distance, very long distance, going back, and you don't have the money. Maybe someone has sponsored you. So you find that the limited number of the professionals to handle the rehabilitation services also affects persons with disabilities negatively, because you have to wait, and there are no hostels or facilities where a person can stay as you've come to either repair or to get a new assistive device, so that you can wait, so that maybe the next day they can work on you, or the other day. So you go back, come back, the next day you find that their device has not been made, because also the other challenge is the hospitals or the rehabilitation facilities lack the equipment and supplies. So you'll come, they have not yet got the equipment or the supplies to make for you the device or to repair. So you go back. At the end of the day, persons with disabilities end up giving up. And also, the other challenge now, because of lack of equipment and supplies, the rehabilitation personnel who are trying in the orthopedic workshops, they try to improvise. You find that they try to fabricate the assistive technology, these walking devices, using jerry cans. How can you make artificial leg by molding a jerry can? It is not sustainable, and you find that at the end of the day, it even causes more disabilities. It wasn't the disability. So as you go and seek for a medical service, and you get the one which is not appropriate, then the end result is that you are going to get the secondary disability.
Okay.
The other one now coming to is the data regarding people using and accessing rehabilitation services. There is limited data. The data is not being collected, such that now the effect there is that when it comes to decision making, you know, we make decisions based on the available data. Now, when you don't have the data, the information on how many people require this, then it becomes quite challenging for decision makers to provide, to even make decisions regarding rehabilitation and assistive technology. So it again affects persons with disability. And then the other one, because of the poverty, but also because of lack of supplies in the hospitals and lack of the personnel, you'll find that people go, and there are now many people masquerading in the market of rehabilitation and assistive technology. You find people making anything because there's no regulation. There should be standards controlling. Now anybody comes providing that I'm providing this, and it gives you substandards equipment, substandard appliances, assistive devices, which at the end of the day cause secondary disabilities to our people. You find that someone has been using a rehabilitation service, but which is not really the one which is recommended. Someone just comes, like you find that the church, for example, comes in because for them they are now sympathizing and on the situation of persons with disabilities because they are not able to provide. So they come in, they purchase wheelchairs. Now persons who get these wheelchairs, it is okay, it is good to get, but they are not assessed. The compatibility of the wheelchair to the person getting it. Just because someone is crawling, someone doesn't have a wheelchair, then they just give anything. So giving the wheelchair which is not compatible to that person causes another secondary disability. So those are some of the challenges. There are quite many.
Can we look at, you did talk about there is no regulation majorly while supplying such equipment. Is there any way maybe the authorities have tried to intervene, maybe organizations like NUDIPU and all those? Is there a way you have tried to intervene?
Yes.
Because there are so many people who really love donating to those persons with disabilities. And so have you been able to intervene and maybe regulate that this one is supposed to go this way, this and this?
One, as NUDIPU, we are an advocacy organization, and we do not have the mandate to do the regulation. The regulation is it's the responsibility of the government. It is the government that has the authority. But as NUDIPU and other civil society organizations, what we have done is to come and sit together with the Ministry of Health. We have the focal person in charge of disability. Of course, the ministry has tried. The government is not really doing nothing, but of recent the government has tried. He has created a desk in the Ministry of Health headquarters where we have a focal point person, a doctor, and also we have the assistant commissioner in charge of disability in the primary health sector, so but is in charge of disability. So now what we have done, we do talk, we do lobby the ministry. We have what we call rehabilitation technical working group meetings, which are hosted by Ministry of Health, which brings together different actors, both private and government. And we sit together and we do raise these concerns to the government, requesting the ministry to make regulations. As I told you earlier, we have planned. We did the study on the status of the orthopedic workshops, and most of the things I'm telling you are things that are coming from that study.
Okay.
So we are in the plan of meeting the ministry and presenting that report. But we have also come up with a position paper regarding the same, where we want to meet the health committee of parliament.
Okay.
So that we discuss with them, and then they can pick out of these many issues the ones that we can prioritize, and we begin. And I think one of them is the regulation, and then the other one is the budget allocation. So those are some of the issues that we are thinking. The ministry, we have arranged the issues that will go to the ministry, and then we also have issues that will go to parliament, and then also issues that we as civil society organizations can also handle. Yeah, because yes, if the church donates, we also need to talk to the church. Yes, as you do, could we involve a rehabilitation professional, a physiotherapist? Let them take some measurements before we donate these things, these appliances, these assistive devices to our colleagues, so that they don't cause other secondary disabilities.
Oh, wow, that is very, very interesting.
Yeah.
A lot is being done down there. Well, so you also did talk about the issue of services being too far to majorly these communities. Like majorly they are only referrals, and maybe here at Mulago and all that. So how is this affecting the overall well-being of the persons with disabilities?
It affects, actually, I want to say the distance is not only long, but very long.
Very long.
Very long. Because you will find one rehabilitation facility in one regional hospital serving like 8 to 10 or even 15 districts. And some of them are quite distant. So being a person with disability, one, you know that persons with disabilities are the poorest among the poor. They missed a lot of opportunities. They missed education, they missed employment, they also missed production, factors of production in their families. So they are very poor. So being poor, they are not able to afford that distance. That distance adds the poverty to them. 3, you find that most of them give up because they are not able to afford transport to keep on going to the very distant rehabilitation facility. So what happens? They just give up and say, for God and myself, let God do the rest. Now there is nothing. This is how God made me. I cannot afford, and they give up. And then of course others, as I said earlier on, they lack the information. There are those who would wish, who could manage, but they don't know, where can I get this? So as a person with disability, due to the distance, it causes other secondary disabilities. It also causes more poverty as you try to get the assistive device or the rehabilitation service. It also affects them in a way that sometimes there are these grants that are given to persons with disability, to community, and some of them end up accessing them. For example, PDM or special grant for persons with disabilities, where a member can get like 1 million. But now when you get that 1 million, it is supposed to be invested in some kind of income generating activity, which is supposed to be bringing income. But how do you expect me, who is crawling, to first think of investing when I don't have a wheelchair? How will I be able to reach the market?
Sure.
So the first thing I will do is first to sort out my mobility issues. So now persons with disabilities again get affected. You get some resources which is meant for development, but because you lack the assistive device and because of the distance, you'll be forced to use that money to sort out yourself. And a wheelchair, the cheapest is about 500,000. And of course, these are not the ones which are, but if you want the other one which is the modern, then it goes to close to 1 million. And now, if you are not earning, and who will give you that money if it's not a donation from a church or from an NGO? So you end up begging, you end up becoming unfunctional, because now rehabilitation supports a person to function well in the community. Now, if the rehabilitation needs are not addressed, then the functionality of the person is affected. So that is why persons with disabilities remain poor and they can't come out of the poverty because they are not rehabilitated. The rehabilitation services are far away from them, and they are very costly, and they are not able to afford them.
Okay.
Yes.
Wow, wonderful. So what is the role of the government in ensuring accessibility or more inclusivity for persons with disabilities, majorly in the services for the health sector?
Yeah, I want to begin with accessibility. When we talk about accessibility, it is in two angles. As you access, for example, the orthopedic workshops,
Okay.
when you reach these workshops, they are making assistive devices. But in the first place, they are not accessible to the persons who are going to access those services. You find that they have steps, they don't have ramps, and they are located, sometimes they are hidden. If you go like, if you went the one of Mulago, how does a person on a wheelchair access it? You've gone and you want to repair it. It is really, it is hidden and it's not very accessible to persons with disabilities. So we need accessibility to a facility. And then the accessibility in terms of availability of the service. The government being the key duty bearer, you know, the government is supposed to provide the services, the health services to all.
Yeah.
So the government is supposed to, one, to prioritize the health services and the rehabilitation. And when you talk of rehabilitation, you don't forget about assistive technology. When I talk about assistive technology, it means the technology that can enable a person with disabilities to function. It could be a walking stick like mine. It could be a wheelchair. It could be lenses. It could also be jaws that can be put in the computer, and then a person with visual impairment is able to use that computer. It could be a hearing aid that can enable a person with the hearing challenges to hear well. It could be anything that can support. It could also be like our sisters and brothers who have the condition of albinism. They need these lotions, sunscreen, that can save their skin from getting cancer. It could be anything else. So it is the role of the government to provide, to prioritize the rehabilitation services, ensure that there is inclusive health for all. So by providing rehabilitation services, the government should be able to prioritize and put. If you look at the health budget, sometimes it is a huge budget, and sometimes we have opportunity that the donors sometimes support to fund. But when you look at the breakdown of that budget, you will not get any budgetary code or vote allocated for rehabilitation and assistive technology. The health budget is more on preventive, is on immunization, is on disorder, but it's not looking at this part. Yet this part is very key for us persons with disabilities. Rehabilitation is very key because it is what can make us functional so that we can be able to achieve and realize our potentials. So the government should, one, prioritize rehabilitation and make sure that the health services are accessible to all. Two, allocate a budget. Within the health budget, can we create a vote that can be catering for rehabilitation? Because what is happening right now is that the allocation on the rehabilitation is on salaries and administrative costs.
Yeah.
But it's not for
not the service. No.
Exactly. So can the Ministry of Health within that budget put some small percentage for rehabilitation and assistive technology? Can they also have assistive technology as one of the priority list of essential drugs? Because a wheelchair is like for a person who is operated. Like other services that you provide, I also need this. So can the government look through and also include assistive technology, assistive products as one of the essential drugs or essential list to be provided, so that it goes to the community. And then the other one is regulation. Can the government regulate? There are many private actors. We are not saying they are bad. They are coming in because they are seeing the gaps that are there. But there should be a regulation so that we don't again cause secondary disabilities in the name of supporting, in the name of helping, and then an individual ends up getting a secondary disability. So again, I call upon the government to come and do the regulation of the players, so that when we know these are the standards. And then the other one is also the referral system.
Okay.
Yes, there should be a national referral system where the government should set the guidelines on how to refer. Because from Abim, how do you reach Mulago? Because some of the services you find in Mulago. Because what I did not tell you is that in this report, what was discovered, most of these regional hospitals, these rehabilitation facilities are not functional. They are old and outdated. Some of them, the technology, I think, which were put, I don't know when, maybe by the colonialists, I don't know. So there are some of the machines are outdated. And now the technology which is now coming in is not able to. So we need, and then the other one is to recruit and deploy the rehabilitation workers. Because one of the challenge again is that we have a few health rehabilitation professionals. We have more health workers, but in the area of rehabilitation, the professionals, some of them are few in certain areas. There are different professionals within the rehabilitation sector. So the government should also try to increase by training them, by recruiting and deploying them, so that they can be able to support people. And maybe the other one is now trying to include in the health training curriculum the aspect of rehabilitation. For example, if we include in the curriculum sign language training, so that as the doctors come out, they are able to interact. Even if these other doctors did not rehabilitation specialists, they should be able to interact with the because not even rehabilitation conditions sometimes require clinical medical attention. So when a person with a hearing impairment comes to the health facility, he should be able, the clinical officer should be able to attend, should be able to diagnose and follow the history of the infection. So those are some of the things that the government should be able to do to assist, so that the rehabilitation, we have what we call inclusive health and rehabilitation facilities for persons with disabilities and all.
Wow.
Yes.
This is very interesting. Thank you so much. And of course, I guess you're getting the insights that, and of course, the valid submissions is giving in regarding the inclusivity of service delivery and also accessibility of these services, specifically to the persons with disabilities. It is quite alarming to see the distances these people, the persons with disabilities, trek to make sure that they get these services only provided at regional referral hospitals and maybe even at Mulago here. So it is quite disturbing. Finding one hospital serving to a total of 10 plus districts, and then that is where everyone is supposed to get a service. And not only that is the challenge, they're also outdated. So a lot really needs to be done. We're going in for a short break, and we are still discussing much in this regard. Short break, we'll return with more.
Issues at hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission. This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission. Issues at hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
Comfort and luxury at its best. That is Protea Hotel by Marriott in Entebbe. It is a festive season. You want to hang out in a very, very organized place. That is Protea Hotel by Marriott in Entebbe. Please reach out to them. They do support us. Please make sure you also support them there, because the voices raised here are very pertinent. Now, here with me, Mr. Populas Aisu, taking us through what inclusivity means, what the government has done, what has been able to be provided, and also the challenges around this whole issue of inclusiveness of persons with disabilities in regards to health services. You've heard when we are still discussing in the first segment how the services are quite far. They're actually very far, not quite far. So it is a big challenge. So what should be done is what we are discussing here. And now I wanted to ask about the national health policy that we have here in Uganda. Is it enough? Is it favoring, is it in any way helping out the persons with disabilities? Or if it is not enough, what should be done? What needs to be changed?
I would like to say, yes, it may not be so much adequate, but even what is there is not implemented. That is a challenge.
Oh.
The challenge we have very beautiful, very, very beautiful laws. Much as we are still trying to agitate for some improvements and some amendments, of course, we are coming from where the government or where the community was not understanding disability, where you find the very derogatory words being used, like imbecile, like calling people mad, yet if they have a mental illness. So, but the laws are somehow amended, and we are still trying to lobby for the amendments. Most of them have been amended, and some of those derogatory words are being removed. But the biggest challenge now is the implementation.
Okay.
The implementation is not really so good. And now when you come to still in health, in the legislation, rehabilitation is still lacking because we don't have the policy on rehabilitation. That is why people come and make whatever they make, supply whatever they supply, do whatever they do in the name of supporting people with disabilities who need rehabilitation services. And the Ministry of Health is trying to come up with a strategic plan, but I think it is not yet operational, it's not yet approved. But I think when it is approved, it can also guide, because those are things that we need to guide in this area of rehabilitation and assistive technology.
Okay.
Yeah, in general health, somehow, but now what is lacking more is on the rehabilitation area, and that is where we need most. Yeah. We need most, because it's not only persons with disabilities. Everybody, as I said earlier on, everybody requires rehabilitation service. So we need to prepare more on rehabilitation, enact more enabling policies that can bring a conducive environment for all to be able to access and utilize rehabilitation services in Uganda.
Wow. And now let's talk about the health care providers. Is there sufficient awareness about the different needs of the persons with disabilities, majorly amongst the health care providers?
It is lacking so much.
Wow.
We have designed a program where we are discussing with the Ministry of Health, where we want to train persons, health practitioners on disability issues. You may find that, you may wonder, most of the conditions that persons with disabilities face require medical attention.
Yes.
And they do. Yes, they do support, they are good in that, they do understand that. But we need to raise awareness on the challenges and the needs of persons with disabilities. For example, you go to the health facility, you'll find that the health facility is not accessible. You find that sometimes they put the walkways, and those walkways where they use this they call the trolleys, where they bring patients to the theater and back. But sometimes you find that those walkways are not accessible to persons with disabilities. If you go to the health facility, we have different categories of disabilities. We have those who are using wheelchairs. We also have people with short stature, whom we call little persons. They are a bit shorter, like maybe to this, their height is, so they cannot be able to use like this counter. So when you go to the health facility, you find that the
counters,
the dispensary where they are dispensing, giving the drugs, it is very high. So, and yet a person who has a little stature, sometimes if the nurse is seated this side, cannot even see, and sometimes they mistake them to be children because of their height. And then if you go to the labor ward, for example, you enter the labor ward, there is no adjustable bed. They should be adjusted, because this is a woman with a disability who is crawling, and you expect her to climb on the high normal ordinary beds, which this lady cannot, or this person with a short stature. And sometimes the health workers make fun of them. You are pretending climb. How did you climb the other day when you get pregnant? How did you get pregnant? How did you climb? Where did you get the pregnancy from? So you find that in the labor room, the health facility, the beds are not accessible. Not only that, sometimes even when you're going to the OPD, you'll find that there are steps. They put steps going, but they are forgetting that there are people who use wheelchairs, but there are also people who use crutches or who use other mobility aids, which find it very difficult to use those stairs to climb.
Yes.
But you find that this is a health facility which should be knowing that there are people who have these different conditions. You find examination tables where if you go to a clinical officer or a doctor's room where they're doing examinations, so you find that is it called a table or a bed, where sometimes you lay and then the doctor comes to examine you, but it is very high, and there is no provision put to support the person who has an impairment or mobility challenge to be able to climb up there to get the service. Sometimes you find, okay, the doors in most cases are wide, but sometimes they are heavy if I'm on a wheelchair, because we don't, in a hospital setting or in any community setting, like even in this radio, we do expect that qualified persons with disabilities should be employed and should be able to utilize and use the services and do it independently. So if we have a health worker or a person who has been in the health department doing that particular job happens to get a disability, what is going to happen? Are you going to discharge because the environment is not accessible for the person? So for us, we are lobbying not for the people only who have disability at the moment, but also there's a potential that anybody else within that environment can also get a disability.
True.
So if the nurse who is serving the drugs gets a disability and she's confined to a wheelchair, how will she be able to access, and how will she be able to serve if the environment is not made accessible? So accessibility is for all. So there is a lot. If you go still to the hospitals and a person who has hearing challenges comes, you'll find that the doctor, the nurse is not able to really examine the person. Last week when we were having a symposium on inclusive health and rehabilitation, one of our colleagues who has a hearing impairment said she was pregnant and she went to the health facility, and of course they were told to sit and line. Now they are calling the names. Of course the her name was given, her book was taken. So they are calling, but there's nobody informing her that it is her. So they are calling. So she doesn't know that she's being called. So for her, she's seated. Now people who come later, people, until she sat so for long, then one of those, the health workers got concerned. What is the problem? So now realizing that she could write, now they asked her, she said, this is my name. She said, why are they calling this name? They said, but I don't hear. How do I know that I'm being called? So sign language is one of the things making the provision of services to persons with disabilities a bit challenging. So those are some of the challenges the health workers face. They don't understand really the gaps, the challenges, the barriers that persons with disabilities face when they come to the health facility to access services. So that's why we need to sit with the health workers, create awareness, raise awareness. Yes, they do not understand the other things, but also tell them, if you want a person with disability to function well, do this, do this. This condition has these barriers and it limits the participation of a person if not addressed. So address this, and sometimes it's not very costly. Sometimes people think that persons with disabilities demands are so high and they are expensive. In certain situations they are not. Like putting a ramp when you are constructing a building, for example. Sometimes you find that the cost of putting the stairs is even high, but putting a ramp, you just put a slope. And when you put that slope, that ramp, again you realize that not only persons with disabilities are using, even the able-bodied persons tend to go to Parliament. One time I went to Parliament, I had gone there, I had an appointment, but when I went, I saw the stairs, but I never saw any MP using them. Those ones who were moving at that time, all of them were using the ramp, which the provision that was created for members of Parliament who have disabilities. Meaning, we put their structures knowing that it is hard for us to use, but we just keep quiet because we are the ones who put them, and we don't know to address them. But whereas if someone comes in and addresses, then you realize. It's like someone when is constructing a house. We normally want to advise, when you are constructing a house, sometimes people construct a flat. It is okay, I'm not saying it is bad, but construct knowing that one day either you'll be having a disability or you'll grow old and you'll not be able to use. So put provisions of accessibility so that when you grow, when you become of age, or when you acquire a disability, you are able to use your own resources that you put well. Otherwise, you will leave the house you constructed to others, and then you will be given a makeshift, because now maybe there are no resources to construct for you at that time now.
Wow. So we've talked about the equipment in the facilities, the health facilities, and maybe it's my last one. How well are they equipped? The health facilities here in Uganda, how well are they equipped to suit well or to accommodate the needs of persons with disabilities?
It is very sad and very appalling. If you went to our orthopedic workshops, I want to be specific now, orthopedic workshops, because this is where most of the rehabilitation for physical disabilities, people who need physical rehabilitation, they normally go to the orthopedic workshops. But if you reach the orthopedic workshops, they are poorly equipped. You will find that the equipment they need to make or to repair several assistive devices. They make several assistive devices, like wheelchairs, they make artificial limbs, they make crutches, walking frames, and so name them. There are quite a number of them. But some of the materials or all the supplies they need to make these things are imported. And when you go and reach those, you find that a majority of them are not there. A majority of what is required is lacking. And as I told you, and what you'll get there, you'll get the old machines which are updated. Some of them are no longer working, and some of the rehabilitation workers are idle. and now they get demotivated. Yes, you get the money, but you are not practicing the skill that you got, and some of them are crossing because you are just there idle. You come and sit in your small confined room, but no, you don't have, you're not able to serve, you're not able, people do not get the pride because you train in that and you really want to provide a service, but you are not able to. So you find that the health workers are demotivated. So generally, the orthopedic workshops are ill-equipped. That's why most of them are not functional. Most of them are not functional because they are under-budgeted. There's no budget for those surplus that they require because for them, more of their work is on making the assistive devices and whatever is required. And now they are still using the analog way. Yet now, there's what we call 3D technology, where you need to have new machines that can do work in a much shorter and faster and most cost-effective way. But even Mulago, which is a government, but you can get these services. I am happy to report that other private practitioners are really supporting a lot. If you go, for example, to Kosu, if you go to Katalema, they do provide, and they have some of those things that I'm talking about. You'll find that they have standard, and really their workshops are functioning, and their rehabilitation, they have and they've put budget, they have really put their funding, and they have really purposed to make it function. But when you come to the government facilities, it is much we need to do. Yes, the government committed during the 2022 Global Disability Summit, the government of Uganda committed to support rehabilitate the orthopedic workshops, 40% of the orthopedic workshops. So yes, they are working towards that, but we are yet to realize the budget to enable the work to go on. Yes, the government is trying. Maybe perhaps the challenge they have is a lack of resources. And then the other thing is the taxation of some of this equipment. Because now the private sector is trying to support. We have the non-for-profit organizations, but also we have those for profit where they make some profit. But some of the appliances they make, they have to reduce because ordinary persons with disability, who are a majority, who are the majority users, are not able to afford. And we have had testimonies from these hospitals saying persons with disabilities come, and then at the end of the day, they fail to pay the costs.
Wow. Thank you so much. This has really been so much helpful, but unfortunately we are cut short by time. So I would request in just a few seconds you give us your last remarks, and then we see how we can move out of here.
I want to conclude by saying we want to request the government to prioritize rehabilitation and assistive technology. Let it be among the essential list for things that go to the health centers. We also want to request that let the rehabilitation professionals be brought up to the lowest level where persons who need them can access, like we have health center 2s, health center 3s, let them brought to that level. And then the conditions that they cannot handle can be referred to the referral hospitals or national referral hospitals. That will enable and support persons with disability. And finally, let the government put some budget, at least a budget for rehabilitation within that health budget, so that at least something can, however little it is, it can do something, and it can be the start, and then progressively the government can be able to increase the funding. And the very last is the regulation on the rehabilitation practitioners, so that we don't have persons who again develop secondary disabilities. Thank you so much.
Wow.
And I would like to greet everybody and call upon all those and thank all those who have been supporting in the area of rehabilitation to continue supporting, and call all organizations of persons with disabilities and others to lobby and advocate for the improvement of rehabilitation services for all.
Wow.
Thank you.
Thank you so much. Mr. Populas Aisu, who is the programs officer at NUDIPU, and he is in charge of economic empowerment and rehabilitation services. We really appreciate the time you have given us here, but most importantly, the insights that you've given out there to make sure that there is an inclusive society outside there in regards to providing services. In this time, we're talking about health care services, but of course, it cuts across all services, regardless of the state we are in. There must be inclusivity. The government has to provide for all, but also you as an individual, when you're constructing a building, are you including those aspects of maybe, like he gave an example of you having a thought in mind that one day either you will grow old or you could get disabled, things like that. So you have to plan purposefully so that you can include every person. Well, my name is Luke Majumba. I want to appreciate you for joining us here today. We are always powered by Protea Hotel by Marriott in Entebbe. I want to wish you a lovely day.
Issues at hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.